olecranon fractures. When you bend your elbow, you can easily feel the tip. That tip is the olecranon. It's positioned directly under the skin without much protection from muscles and other soft tissues. Because of that, it can easily fracture if you experience a direct blow to the elbow or falling down on bended elbow. Okay, so this olecranon is not much protected by muscles and ligaments, so it is easily fractured by any direct blow or falling down on bended elbow. Signs and symptoms of olecranon fracture is like other fractures: pain, swelling, numbness of the finger, failure of extending the forearm, and bruising. All these signs and symptoms, which is common in all elbow and arm fractures, can be present. On X-ray, we can see the fracture. We have to use the X-ray to determine whether the fracture is a transverse fracture, or comminuted fracture. Is it displaced like here, or it is not displaced? Okay, so these are the benefits of the X-ray. And other benefits of the X-ray is to see whether we have other fractures or not. Classification of olecranon fractures is comminuted or transverse simple fracture. We can further classify the comminuted fractures into comminuted displaced or comminuted non-displaced. Okay, undisplaced or displaced comminuted. Also, the simple transverse fracture can further subdivided into undisplaced transverse or displaced transverse. Okay, undisplaced transverse or displaced transverse. So, comminuted, non-comminuted or transverse fractures both can be classified into undisplaced comminuted, undisplaced transverse, or displaced comminuted, displaced transverse. Of course, there is an extreme case which is unstable comminuted and transverse classification. Again, let's show the X-rays to focus on undisplaced transverse fracture. Here is displaced transverse fracture. Here again is undisplaced transverse fracture. هون بنشوف comminuted fracture. Okay, comminuted undisplaced in this case. Okay, so there are two types, as we said. Now let's move to the treatment of fractures of the olecranon. It depends whether it is comminuted or transverse. In the case of comminuted fractures with a triceps muscle intact, like here, okay, this is comminuted fracture and the triceps contact, we are going to use the sling. Okay, we treat conservatively with a sling until the pain subsides. When the pain subsides, we can do some exercises. Okay, exercises, etc. This is in case of comminuted fractures. In the case of transverse fractures, we have to see whether it displaced or undisplaced. In the case of undisplaced fractures, we should apply immobilization first, immobilization, and we have to put a sling. Immobilization and applying a sling. Okay. In the case of transverse and displaced fractures, we have to do open reduction and internal fixation. Open reduction and internal fixation. I don't want to forget that the sling is in about 60-degree flexion. Okay, we put the sling with about 60-degree flexion for 1 week. The sling is put, then movement is encouraged, okay, and etc. Don't forget to do a neurovascular examination before and after the procedures. We have always to do a neurovascular examination. Of course, this is open reduction after displaced a transverse fracture. This X-ray here show us internal fixation after the open reduction with plate and screws. Okay, this is internal fixation. This is all about olecranon fractures. See you in the next video.